It's a chilly night, and you're up again, coughing. You've tried every cough syrup on the shelf, sipped honey and lemon tea, and even propped up your pillows to sleep at an angle, but that nagging nighttime cough just won't quit. Then someone, maybe your grandmother, maybe a neighbor, says, "Rub some Vicks on the bottom of your feet. It'll stop the cough." It sounds almost magical, doesn't it? Just a dab of that menthol-scented ointment rubbed into your soles, and your cough will melt away into a peaceful night's sleep. But here's the question. Does this home remedy actually work? And if it does, how? Is there something special about our feet that makes them a secret pathway to calm a cough? Or is it just a comforting story we tell ourselves, one that feels so real it becomes real? Today, we're taking a deep dive into this fascinating health belief. Why so many people swear by rubbing Vicks on their feet for a nighttime cough, where this idea comes from, whether science backs it up, and what you should know before trying it, especially if you're over 60. Let's start with what we know. Vicks VapoRub has been a household staple for generations. If you grew up in the US, chances are you remember that familiar blue jar tucked into your family's medicine cabinet. That strong, menthol-heavy scent, courtesy of ingredients like menthol, camphor, and eucalyptus oil, was the smell of comfort, care, and hope when you were sick. But the idea of putting Vicks on your feet? That's a bit of a twist. After all, Vicks is labeled as a chest rub. The instructions say to apply it to your chest, throat, or back, not your feet. So how did this practice become so widespread? The truth is, the origins of the Vicks-on-feet remedy are a bit murky. Some say it started as an old wives' tale passed down in families, especially in rural areas where folk remedies often thrived. Others point to the idea of reflexology, the practice of applying pressure or stimulation to specific points on the feet that correspond to different organs and systems in the body. According to reflexology maps, certain points on the soles of the feet are believed to connect to the lungs, throat, and sinuses, areas directly involved in coughing. For many, this idea resonates. It feels intuitive even if it's not written in medical textbooks. After all, when you have a cough that just won't quit, you'll try almost anything. And when you hear a story, "My grandma always rubbed Vicks on our feet, and it worked every time," it sticks. Anecdotes like these are powerful. They're part of our collective memory, woven into family traditions and bedtime rituals. There's also something comforting, almost ritualistic, about the act itself. The warm sensation of the rub, the soothing scent of the menthol, the feeling of being cared for, whether by someone else or by yourself, can all contribute to a sense of relief, even before you fall asleep. But what does science have to say about all of this? Are there studies that prove Vicks on the feet actually stops a cough? Or is this just one of those folk remedies that feels good, but doesn't have much evidence to back it up? That's where things get interesting. A search through medical journals reveals that there are no direct peer-reviewed studies on the effectiveness of rubbing Vicks on the feet to stop a cough. No clinical trials, no controlled experiments, just a lot of stories passed from person to person. However, there are studies on the general use of Vicks for cough relief. For example, a 2010 study published in the journal Pediatrics looked at the effect of Vicks VapoRub applied to the chest of children with nighttime coughs. The study found that the children who received Vicks reported better sleep and improved cough symptoms compared to those who received a placebo or no treatment at all. But remember, this study focused on chest application, not feet. So if there's no direct scientific evidence for the feet method, why do so many people report that it works? Well, this is where we can explore some interesting theories. One theory is that of sensory distraction. When you apply something strong-smelling and tingly like Vicks to your feet, it creates a new sensory input, one that may override or at least shift your focus away from the irritation in your throat that's triggering the cough. The brain can only focus on so many sensations at once, and the menthol aroma plus the tingling feeling on your skin might help trick your brain into quieting the cough reflex, at least temporarily. Another possible explanation involves the placebo effect, a fascinating and powerful phenomenon where simply believing that a treatment will work can make you feel better. If you expect relief, your brain may respond in ways that actually do reduce symptoms. That's not to say the relief isn't real, just that it may come from your brain's expectations rather than the treatment itself. Of course, there's also the reflexology theory to consider, the idea that massaging specific points on the feet can influence the health of corresponding organs in the body. Reflexology is an ancient practice with roots in Chinese and Egyptian traditions, and it's still popular today in holistic health circles. However, the scientific evidence for reflexology as a way to directly impact respiratory symptoms like coughing is limited and often debated, so we have a mix of tradition, sensory experience, and psychological effects that could all play a role in why people feel better after rubbing Vicks on their feet. But before we get carried away, we need to ask an important question. Is this remedy safe, especially for seniors? And are there better options out there for nighttime cough relief? When we think about safety, especially for seniors, it's crucial to consider how the body changes as we age. Skin becomes thinner and more sensitive, circulation slows, and some ingredients that might be harmless for a younger person could cause irritation or even harm in someone over 60. Vicks VapoRub contains ingredients like camphor, menthol, and eucalyptus oil, which can be strong irritants for some individuals. For example, camphor, one of the main active ingredients in Vicks, is actually classified as a potentially toxic substance if ingested or absorbed in large amounts. That's why Vicks containers have warnings: do not apply to broken skin, do not ingest, and keep out of reach of children. For most people, applying a small amount of Vicks on intact skin, like the chest, is safe, but applying it to sensitive areas or using too much could lead to skin irritation, redness, or even a mild burning sensation. When it comes to the feet, while they're generally less sensitive than areas like the face or neck, they're still part of your skin system. And seniors, especially those with conditions like diabetes, should be cautious. If you have neuropathy or reduced sensation in your feet, you might not feel an adverse reaction developing, which could lead to problems like skin breakdown or infection. Another safety concern is the risk of slippery feet after applying an ointment like Vicks. Imagine applying a generous layer of ointment, then standing up on a hard floor or bathroom tile. The last thing anyone needs, especially seniors, is an increased risk of falls, one of the leading causes of injury in older adults. So while rubbing Vicks on your feet is unlikely to cause serious harm for most people, it's not without its risks, especially for those with certain health conditions or fragile skin. Now, if the Vicks-on-feet method isn't strongly supported by science, and it carries some potential safety concerns, what can seniors do instead to manage a nighttime cough? First, let's talk about why nighttime coughs can be so persistent. When we lie down, gravity isn't helping us as much to keep mucus from pooling in the upper airways. This can lead to postnasal drip or mucus accumulation in the throat, triggering that tickling, nagging sensation that makes you cough. Certain conditions like acid reflux, chronic bronchitis, or even mild heart failure can also cause nighttime coughs, and these issues become more common as we age. One of the simplest and most effective remedies for nighttime cough is to sleep with your upper body slightly elevated. Propping up with an extra pillow or using an adjustable bed can help reduce the pressure on your airways and make it easier to breathe. Another important factor is maintaining good air quality. Dry air can irritate the throat and nasal passages, making a cough worse. Using a humidifier in your bedroom, especially during the winter months when the air tends to be drier, can help soothe irritated tissues and reduce coughing. Just make sure to clean the humidifier regularly to prevent mold or bacteria buildup. If postnasal drip is a problem, common in seniors due to chronic sinus issues or allergies, using a saline nasal spray before bed can help keep the nasal passages clear. Some people also find relief from using a neti pot or saline rinse earlier in the day to flush out excess mucus. Of course, hydration is key. Sipping warm fluids like herbal tea or broth can help thin mucus and soothe the throat. Honey, in particular, has been shown in some studies to be effective at calming coughs. Just a spoonful of honey before bed can be a simple natural remedy. For those dealing with chronic coughs, it's essential to identify the underlying cause. A persistent nighttime cough could be a sign of something more serious, like asthma, gastroesophageal reflux disease, GERD, or even heart problems. That's why it's important to talk to a healthcare provider if a cough lingers for more than a few weeks, or if it's accompanied by other symptoms like shortness of breath, chest pain, or unexplained weight loss. Let's circle back to the Vicks-on-feet method for a moment. While there's no strong scientific evidence supporting it, that doesn't mean it never helps anyone. It's entirely possible that for some people, the ritual itself, massaging the feet, smelling the menthol, feeling cared for, provides comfort and a sense of control over an annoying symptom. And comfort matters. Feeling nurtured, especially when you're sick, can reduce stress, promote relaxation, and help you sleep better. But here's the key. It's important to understand the limits of folk remedies. They can be part of a soothing bedtime routine, but they shouldn't replace proven treatments or medical advice, especially for seniors with chronic health issues. So what's the bottom line? The bottom line is this. Rubbing Vicks on your feet might make you feel better, but it's not a guaranteed cure for a nighttime cough, and it's certainly not a substitute for proper medical care when needed. The sensation of menthol, the calming scent, the gentle massage on the soles of your feet, these are all elements that can help you relax. And sometimes, that relaxation is enough to ease the tickle in your throat, calm your breathing, and help you drift off to sleep. But it's important to remember that while the brain is powerful, it's not magic. If there's an underlying condition causing your cough, like reflux, allergies, or a respiratory infection, simply rubbing Vicks on your feet won't address the root problem. It might give you temporary relief, but it's not a long-term solution. Let's also think about the placebo effect here. Placebo isn't a dirty word. It's a real, measurable phenomenon. Countless studies have shown that when people believe a treatment will help, their brain releases chemicals like endorphins that can actually improve how they feel. In a way, our minds can become a kind of medicine cabinet, tapping into the body's natural healing systems. So if your grandmother always told you to rub Vicks on your feet, and it seemed to work for you as a child, your brain may associate that action with feeling better. That doesn't mean there's a direct physical mechanism connecting menthol on the feet to cough relief, but it does mean your body's own relaxation response and the power of positive expectation might be playing a role. There's also a comfort factor to consider, especially for seniors. Many people grew up with these home remedies as part of their family culture. They're not just treatments, they're memories. A parent's caring touch, a familiar smell, a soothing voice. All of that can make a person feel safe and cared for, which can reduce anxiety and promote rest. That said, there are better evidence-backed strategies for dealing with a nighttime cough. We've already talked about humidifiers, hydration, honey, and positioning, but there are also over-the-counter medications that can help, though it's important to use them wisely. For example, some seniors might reach for a cough suppressant, like dextromethorphan, found in products like Robitussin or Delsim. While these medications can reduce the urge to cough, they also come with potential side effects, especially for older adults. Drowsiness, dizziness, and even interactions with other medications are possible concerns. That's why it's always a good idea to check with a healthcare provider before adding any new medication to your routine. For those with a chronic dry cough that lingers for weeks, it's crucial to investigate the cause. Conditions like GERD, asthma, or even side effects from blood pressure medications like ACE inhibitors can lead to a persistent cough. Addressing the underlying issue is key to getting real, lasting relief. So where does that leave us with Vicks-on-feet? It's a fascinating case study in the intersection of tradition, science, and the human experience. The belief is widespread, the stories are plentiful, and for many, it feels like a trusted remedy. But when we look at the scientific evidence, we don't find strong support for the idea that rubbing Vicks on the feet can directly stop a nighttime cough. What we do find is that the act itself, massaging your feet, breathing in the menthol, creating a calming bedtime ritual, can contribute to relaxation, a sense of well-being, and perhaps a more restful night. It's not magic, but it's not meaningless either. That's the beauty of exploring folk remedies like this one. They remind us that healing isn't always about a pill or a prescription. Sometimes it's about the small acts of care we give ourselves and each other, the rituals that connect us to our families, our cultures, and our sense of hope. But it's also important to stay grounded in what the science tells us. When it comes to a stubborn nighttime cough, especially for seniors, it's always best to consider the full picture. Are you hydrated? Is your sleeping environment supportive? Could an underlying condition be contributing to the problem? And if so, what does your doctor recommend? In the end, there's room for both tradition and science in our approach to health. You can enjoy the comforting ritual of rubbing Vicks on your feet. If it makes you feel good, why not? Just don't rely on it as your only line of defense. So what's the best way to balance the comfort of a folk remedy like Vicks on the feet with the practical need for effective cough relief, especially as we age? It starts with understanding that remedies like this often serve a psychological and emotional purpose as much as a physical one. That caring touch, that familiar scent, the act of doing something, all of these can provide a sense of control when you're feeling vulnerable. And that matters. But it's also vital to recognize when it's time to go beyond home remedies and seek medical advice. If you have a cough that lasts more than 3 weeks, if it's accompanied by other symptoms like fever, weight loss, or shortness of breath, or if it's interfering with your daily life, don't wait. Talk to your healthcare provider. They can help you explore possible underlying causes, whether it's a lingering post-viral cough, acid reflux irritating your throat at night, a medication side effect, or something more serious like chronic bronchitis, or even early signs of heart failure. For nighttime coughs related to postnasal drip, they might suggest an antihistamine or a nasal spray. For reflux, they could recommend dietary changes or medication to reduce stomach acid. For a dry, tickly cough, a humidifier or even honey in warm tea might be your best ally. The key takeaway is that there are evidence-based options available, tailored to your unique health needs. And while the Vicks-on-feet method may feel comforting, and for some, it might even seem to work in a way that helps them relax, it's not a substitute for understanding the root cause of your cough or following medical advice. That doesn't mean you have to throw tradition out the window. If the act of rubbing Vicks on your feet brings you comfort, there's no harm in doing it, as long as you're aware of its limitations and any safety considerations, like avoiding it on broken skin, being mindful of potential skin irritation, and watching out for slipperiness. It's all about balance, honoring the stories and rituals that bring us peace while also making informed, safe choices about our health. As we wrap up this investigation, let's reflect on what we've learned. Rubbing Vicks on your feet to stop a nighttime cough is a beloved folk remedy with deep roots in family traditions. It taps into the power of touch, scent, and the human desire for comfort. While there's no solid scientific evidence that it works through reflexology or any specific biological pathway, The sensory experience and placebo effect may explain why it feels helpful for some. However, it's not a cure-all, and it shouldn't replace evidence-based approaches, especially for seniors who may have underlying conditions that need medical attention. So if you're battling a nighttime cough, it's wise to consider safe, proven strategies like staying hydrated, using a humidifier, elevating your head at night, and consulting a healthcare provider if the cough persists. Ultimately, the story of Vicks-on-feet is a reminder that health is about more than just what's in the medicine cabinet. It's about how we care for ourselves and each other, how we pass down traditions, and how we balance comfort with knowledge. Thank you for watching, and if you found this video helpful, we'd love it if you'd leave a comment sharing your own family remedies or experiences with Vicks. Don't forget to like, subscribe, and hit the notification bell so you never miss a new video from Stronger After 60. Until next time, stay curious, stay informed, and stay healthy.